Bonjour à tous, bienvenue à la conférence de presse d'aujourd'hui. Hello everyone, welcome to today's press conference. Je vais passer la parole au ministre LeBlanc.
Alors, bon après-midi tout le monde.
Good afternoon, everyone.
Good afternoon. Today I'm joined by my colleague Patty Hajdu, the Minister of Health, and Doctors Tam, New, and Sharma. We are seeing an increasing number of vaccines arriving in Canada each and every day, and more Canadians are also receiving their vaccine. This is extremely positive news. Nous remercions les Canadiens pour tout ce qu'ils font dans la lutte contre le COVID-19 et nous vous demandons de continuer vos efforts dans cette lutte si importante. The fight against COVID is not over yet. It is still important that we all follow local health guidelines, wear a mask, and keep the appropriate social distance. And with that, I'd like to now turn the press conference over to my colleague, Patty Hajdu. Patty?
Thanks very much, Dominic, and thanks to all the officials that are with us today. As many Canadians know, Dr. Tam and Dr. New and many other experts across the country have spoken about the importance of following public health measures, even if we are seeing increasing numbers of Canadians being vaccinated. And the reason is simple. COVID-19 is still spreading. In fact, in some places, we're seeing increases in daily cases. We still have challenges in hospitalizations, and the proportion of new variant cases is also rising. So as my colleagues are reminding us, we have to continue to make choices that reduce our risk of spreading COVID-19 and isolate and get tested if we think we've been exposed to the virus. Now, I know it's not always easy for everyone to isolate. We know that many people live in crowded or multi-generational situations. There are restrictive costs that make it difficult for people to self-isolate when necessary. And of course, all of these challenges raises the risk of community and household transmission. And that's why today we're confirming an additional $23.7 million in federal funding to operate isolation sites in regions such as Toronto, Peel, York, and Durham, and we're finalizing the details for similar sites in Thunder Bay, Windsor, and other regions. There are currently 5 rooms, fully federally funded in Ontario. Today's funding will allow for an additional 1,600 rooms to be created, bringing the total to approximately 2,000 rooms in the province. Now, these rooms are going to be of great use for people that contract COVID-19 and want to protect the members of their household from also contracting the disease. It's really important that public health units work with their local municipalities and that they support citizens to properly isolate when they've been diagnosed with COVID-19 so that we can curtail the spread. Thank you very much, and I'll turn it back to you, Dominic.
Thanks, Patty. And I should have mentioned Dr. Berthiaume is also joining us and will be available to answer questions. But now we'll turn it over to Dr. Tam and Dr. New. Dr. Tam.
Thank you. Bonjour à toutes et à tous. And this week, as vaccine delivery begins to ramp up at an accelerated pace, there are hopeful signs for better days ahead. However, increasing case counts, a rising proportion of new variant cases, and shifting severity trends are cause for continued caution. To date, over 938,000 cases of COVID-19, including over 22,700 deaths, have been reported across Canada. Over the past week, there has been a further 15% increase in daily cases, with an average of over 3,600 new cases daily. Increased infection rates are starting to impact severe outcome trends, including hospitalizations and deaths. Over the past 2 weeks, these lagging indicators of COVID-19 severity have leveled or increased. On average, over the past week, 31 deaths were reported daily, and over 2,100 people with COVID-19 are being treated in our hospitals each day, including over 580 in critical care. To date, close to 5,500 variants of concern cases have been reported across Canada, with a B117 variant accounting for over 90% of these to date. As the number of new variant cases continue to increase, they account for a greater proportion of COVID-19 cases across Canada, reminding us of how tight the vaccines versus variants race continues to be. Though we're all tired of the tricks and turns of this virus, we have progressed and met each challenge along the way, and we'll be better and stronger for it. With spring here and vaccines rolling out, we've got more daylight hours and much cause for optimism for the warmer days ahead. The vaccines that we prioritize to protect high-risk populations and those who help keep our pandemic response, society, and economy running are beginning to show benefits. Prioritizing seniors and long-term care, followed by those in the community, has contributed to much reduced infection rates among seniors. Just as they have paved the way for the life we have in Canada through hard work and sacrifice, seniors are once again showing us their leadership and determination by rolling up their sleeves for COVID-19 vaccines. Though it may not be your turn yet, there are many ways younger adults can pay it forward and help family, friends, and neighbors get vaccinated. Many may have already helped a parent or grandparent book their vaccination appointments. You now have experience in navigating your local vaccination rollout system, so there may be others that you can reach out to. Working online, over the phone, or in other ways, you can help others. Like so many areas of health, no one is protected until we are all protected. Be a vaccination champion by providing credible information on COVID-19 vaccines or practical assistance to help others. And as we look with increasing optimism towards our future, following public health advice and maintaining individual protective practices remains important for keeping us all safer and clearing the runway for vaccines to do their part. Thank you.
Bonjour à toutes et à tous. Cette semaine, à
Good day,
mesure que
everyone.
les vaccins nous sont livrés
This
plus
week,
rapidement, il y a des signes
as vaccine
encourageants de
delivery
jours
begins to
meilleurs
ramp
à
up
l'horizon.
at an accelerated pace,
Cependant,
there are
compte
hopeful
tenu
signs
d'une
for better
augmentation
days
du
ahead.
nombre de cas,
However,
d'une hausse de la
increasing case
proportion des
counts,
cas de nouveaux
a
variants
rising
et
proportion
des
of new
tendances
variant cases,
changeantes en
and
matière
shifting
de
severity
gravité,
trends
il faut continuer
are
de faire
cause
preuve de
for
prudence.
continued caution.
À ce jour, plus de 938
To date,
000 cas de
over
COVID-19, dont plus
938,000
de
cases
22
of
700
COVID-19,
décès, ont
including
été
over
signalés au Canada.
22,700 deaths,
Au cours de la
have been
dernière
reported
semaine,
across
il y a
Canada.
eu une
Over
augmentation
the
du
past
nombre de
week,
cas
there's been a
quotidiens de
further
15%,
15%
soit
increase
près de
in
3600
daily
nouveaux cas par
cases,
jour en
with an
moyenne.
average of over
La hausse des taux
3,600 new
d'infection
cases
commence à
daily.
avoir des répercussions
Increased
sur les
infection
tendances liées
rates are
aux cas
starting to
graves,
impact severe
notamment
outcome
les
trends,
hospitalisations et
including
les décès.
hospitalizations
Au cours
and
des 2
deaths.
dernières semaines, le nombre
Over
de
the
ces
past 2
indicateurs de
weeks,
gravité
these
tardive de la
lagging
COVID-19
indicators
s'est
of
stabilisé
COVID-19
ou a
severity
augmenté.
have leveled
Au
or
cours de la dernière
increased.
semaine,
On
31
average, over
décès
the
ont
past
été
week,
signalés et
31
plus de
deaths were reported
2100
daily,
personnes
and
atteintes de
over
la COVID-19
2,100
ont
people
été
with
traitées dans nos
COVID-19 being
hôpitaux
treated in our
quotidiennement,
hospitals each
dont
day.
plus de 580 aux
This
soins
includes over
intensifs.
580
Jusqu'à
in
présent,
critical
près
care.
de 5500
To
cas
date,
de variants
close to
préoccupants ont été
5,500
signalés
variants
au
of
Canada.
concern
Le variant
cases have been
B117
reported across
représentant à ce
Canada.
jour plus de 90%
B117
de
variant
ces cas.
accounting for over
À
90% of
mesure
these
que
to
le
date.
nombre de cas de nouveaux variants
As the number
continue
of new
d'augmenter,
cases,
ceci
variant
représente
cases
une plus
specifically,
grande
continue to
proportion des
increase,
cas de
they account
COVID-19 au
for a
Canada,
greater proportion of
ce qui nous
COVID-19
rappelle
cases
à
across
quel point
Canada,
la course entre la
reminding us of how
vaccination
tight the
et les nouveaux
vaccines
variants
versus
est
variants
serrée.
race continues to
Nous
be.
en avons tous assez des revers
Though
de
we are
ce
all
virus,
tired
mais
of
nous
the
avons
tricks and turns of
progressé
this
et
virus,
relevé
we
tous les
have
défis
progressed and
en
met
cours
each
de route.
challenge along the
Et
way,
nous en ressortons
and we are
meilleurs
better
et
and
plus
stronger
forts.
for it.
Avec l'arrivée du printemps et la mise en
With
œuvre de la
spring here
vaccination,
and
nous
vaccines
avons
rolling
plus
out,
d'heures de clarté
we've got
et
more
toutes les
daylight
raisons
hours
d'être
and much cause
optimistes
for
en
optimism
prévision des
for the
beaux
warmer
jours.
days ahead.
Les vaccins auxquels nous avons accordé
The
la
vaccines
priorité pour
that we
protéger les
prioritize
populations
to
à risque
protect
élevé
high-risk
et les
populations
personnes qui
and
continuent
those
de
who help keep
contribuer
our
à
pandemic
notre
response,
intervention de lutte contre la
society,
pandémie
and
et au
economy
fonctionnement de
running
notre société
are
et de
beginning
notre
to show
économie
benefits.
commencent à répandre leurs bienfaits. Accorder la priorité aux
Prioritizing
aînés dans les
seniors in
établissements de
long-term
soins de longue
care,
durée, puis à ceux qui vivent dans les
followed by those
collectivités,
in the
a largement
community.
contribué à réduire
This has
les taux
contributed
d'infection
to much reduced
chez les
infection
aînés.
rates among seniors.
Tout comme ils ont ouvert la voie à la vie que
Just
nous
as
avons
they
eue au
have paved
Canada
the way for
par
the
leur
life we have
travail
in Canada
acharné et leur
through hard work
sacrifice,
and
les aînés
sacrifice,
font une fois de
seniors
plus
are once again
preuve de
showing
leur
us their
leadership et
leadership
de leur
and
détermination
determination
en retroussant
by
leurs
rolling
manches
up their
pour se faire
sleeves
vacciner
for
contre la
COVID-19
COVID-19.
vaccines.
Bien que ce ne soit peut-être pas encore votre tour,
Though
il
it
existe de
may
nombreuses
not be your
façons pour
turn
les
yet,
jeunes
there
adultes
are
de
many
donner
ways
aux
younger
suivants
adults can
et
pay it
d'aider leurs
forward
familles,
and help
leurs
family,
amis et leurs
friends,
voisins
and
à se
neighbors
faire
get
vacciner.
vaccinated.
Bon nombre ont déjà aidé un parent ou un
Many
grand-parent
may
à
have already
prendre
helped a
un
parent
rendez-vous
or
pour
grandparent
recevoir
book
le
their
vaccin.
vaccination
Vous
appointment.
savez maintenant comment
You
naviguer
now
dans
have
le
experience
système de
in navigating
réservation
your
locale.
local
Vous
vaccination
pourrez donc
rollout
aider
system.
d'autres
So there
personnes,
may be others
que
that
ce
you can
soit en
reach out
ligne,
to,
au téléphone
working
ou
online,
d'autres
over the
façons.
phone, or in
Comme
other
c'est
ways
le
you
cas
can
dans
help
de
others.
nombreux domaines de la santé, personne n'est
Like
protégé
so many other
tant que
areas,
nous ne sommes pas
so many
tous
areas of
protégés.
health, no one is
Soyez
protected
donc un
until we are
champion
all
de la
protected.
vaccination
Be a
en
vaccination
apportant de
champion
l'information
providing
crédible
credible
sur les
information
vaccins contre la
on COVID-19
COVID-19 ou
vaccines
de l'aide
or
concrète
practical
aux autres.
assistance to help
À
others.
mesure que nous envisageons l'avenir avec un
As we
optimisme
look with
accru,
increasing
il demeure
optimism towards
important
our
de
future,
continuer de
following
respecter les
public
consignes de
health
santé
advice
publique et
and
d'appliquer les
maintaining
pratiques
individual
individuelles
protective
pour nous
practices
protéger afin
remains
de laisser le
important
temps aux vaccins de
for
faire
keeping
effet.
us all
Merci.
safer and clearing the runway for vaccines to do their
Thank
part.
you. Thank you very much, doctors. And Corinne, over to you now. We'll all be happy to take questions.
Merci. Nous allons donc commencer la période de questions.
Thank you.
Toutes les
We'll start with the
questions
question
aujourd'hui
period.
sont au téléphone. Nous allons prendre donc une question
All
de
questions are
suivi
over the phone. One
chacun.
question, one
We
follow-up
will now
each.
start the question period. Everyone today is on the phones. We will take one question, one follow-up question each. Opérateur, première question.
Thank you. Merci. Please press star one at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. La première question, our first question, Marie Vastel, Le Devoir. À vous la parole. Please go ahead.
Marie Vastel from the Le Devoir.
Oui, bonjour. Je ne sais pas si ma question
hello.
s'adresse plutôt à la Dr Tam
I'm
ou
not sure
la
if the question
Dr
goes to
Sharma
Dr.
ou
Tam
le
or Dr.
Dr
Sharma
Berthiaume. Donc,
or
je vais la
Dr.
poser en
Berthiaume.
français, puis Dr. Sharma, if you want to answer in English, that's fine. Donc, c'est au sujet du vaccin AstraZeneca.
It has to do with the
On
AstraZeneca
apprenait
vaccine.
aujourd'hui que le National
We hear
Institutes of
today
Health des
that the National
États-Unis s'est
Institutes
dit
of Health in the
préoccupé
U.S.
par un essai
said
clinique aux
it was
États-Unis en
concerned
disant
about a
que
clinical effect in the U.S.,
la compagnie may
stating
have included outdated information on efficacy. Et donc, je voulais savoir, est-ce que
So I was
la
wondering
santé publique
whether public
partage
health
ces
shares these
préoccupations-là
concerns,
des autorités américaines
the
quant au
concerns of
vaccin
the American
d'AstraZeneca?
authorities as to the
Et qu'est-ce
AstraZeneca
que vous dites aux
vaccine?
gens
And
qui
what would
sont
you
de
say
plus
to
en
people
plus
who
inquiets ou en tout cas mal à l'aise
are
avec ce vaccin-là, celui
increasingly
d'AstraZeneca?
uncomfortable with that AstraZeneca vaccine?
Bonjour, Madame Vastel. Ici le docteur
Ms.
Marc
Vestel,
Berthiaume de
this is
Santé
Marc
Canada. Je peux
Berthiaume from
peut-être
Health Canada.
commencer
I
là,
can
à
start
répondre à votre question. Alors,
with answering your
Santé
question.
Canada est au
Public
courant
Health
de
Canada is
l'avis qui a
aware
été émis
of
par
the
l'Institut
notice issued
national
by the
des
National
allergies
Institute
et des maladies infectieuses des
in the
États-Unis.
U.S.
Cet avis réfère à
This
des informations
has
sur les
to
essais
do
cliniques qui
with
ont été
information on the
conduits aux
clinical
États-Unis.
studies that were
Les essais
conducted in
cliniques qui ont
the
été conduits aux
U.S.
États-Unis n'ont pas encore été soumis à
They
Santé
were not
Canada et
submitted.
devraient
Those were
l'être
not
probablement
submitted
d'ici
to
4
Health
à 5
Canada.
semaines. Donc, c'est
So
une information
we'll get them within
que le
4 to 5 weeks.
manufacturier
So
doit
this is
soumettre à
information
Santé
the
Canada.
manufacturer has to
Ceci dit,
submit
ce
to
qu'on
Health
peut dire aux
Canada. But what we
Canadiens,
can
c'est
say
que
to
le
Canadians
vaccin
is that the
de
vaccine,
AstraZeneca a été approuvé au Canada sur la
AstraZeneca
base
vaccine,
d'autres
was
essais cliniques qui ont
approved in
été
Canada on the
revus
basis of
en
other
détail par Santé
clinical
Canada,
tests that was
qui ont démontré
examined in detail by
l'efficacité du
Health
vaccin.
Canada,
De
showing
plus, de
the
nombreuses
efficacy
études
of the vaccine.
post-commercialisation ont
Many
établi que le vaccin
post-marketing
d'AstraZeneca était efficace pour prévenir
tests have also
la
shown
maladie, mais surtout
that
les
AstraZeneca is
hospitalisations
effective
et les
against the illness
complications
and
reliées à la
especially
COVID-19. Donc, le
hospitalizations or
message, c'est que
complications related to
l'efficacité
COVID-19.
et
So the message
l'innocuité
is
du vaccin
the
d'AstraZeneca
efficacy
est
and
clairement
safety
démontrée
of
sur la base des
AstraZeneca
données qui ont
vaccine has
déjà
been
été fournies
shown
à
on the
Santé
basis
Canada.
of data that
Les
has already
données
been
additionnelles
provided to
des
Health Canada,
essais qui ont eu lieu aux
and
États-Unis
additional
ont été données vont
information
être soumises à Santé Canada dans les prochaines
that was
semaines.
collected in
On
the
va
US will
revoir ces
be
données-là. Puis si
sent
jamais il y a
to
nécessité de
Health
communiquer
Canada the
avec les
coming
Canadiens,
weeks,
nous
and
allons
if
le
there is a
faire à ce
need
moment-là.
to
Les questions qui ont été
readjust, we
soulevées
will do that with
par
Canadians later.
l'Institut national aux États-Unis référaient
The
plus
issues
à
referred
l'efficacité, la
to in the
façon
US
d'interpréter
have
les
to do
données
with the
d'efficacité. À ma
efficacy
connaissance, il n'y a pas eu
data
de
and how to
questions soulevées au
interpret
niveau de
them.
l'innocuité du vaccin.
There was
Donc, à
no
ce
concern
moment-là,
as to
ça
the
devient une
safety of
question
the vaccine,
d'interpréter des
so it has to do
pourcentages.
with
Mais de façon globale,
analyzing
le
percentages
message, c'est que
in a
le
global
vaccin
sense.
d'AstraZeneca
The
continue
AstraZeneca
d'être
vaccine continues to
bénéfique pour les
be
Canadiens pour
beneficial for
prévenir la
Canadians
COVID-19.
to prevent
Merci.
COVID-19. Thank you.
Et bonjour,
Absolutely.
c'est Dr. New. Peut-être je vais ajouter quelques
This
mots
is
en
Dr.
français
New.
aussi.
Perhaps I can add a few more
De la
words
perspective de la
in
santé
French.
publique,
From the
nous
public
sommes au courant
health
avec
perspective, we are
ce que
aware
nos collègues de Santé Canada font le
of
bon
what
travail avec leurs
the
homologues
excellent work that our colleagues
à
from Health
travers le
Canada are
monde, aussi
doing
aux
with their
États-Unis.
counterparts
Nous
in the
autres,
US.
on travaille
Of
étroitement
course, we
aussi
work
avec nos
closely
homologues de
with
santé publique, ministres et
our
hygiénistes
colleagues
des provinces et
from the various
territoires. Et
provinces
c'est
and
sûr aussi
territories,
que le
our
Comité
counterparts.
consultatif national de l'immunisation
The
aussi
National
vont examiner,
Immunization
analyser
Committee
aussi les
will
données
also
probantes qui
be looking
arrivent
at
au fur et à
the
mesure pour aussi
data and the
donner
evidence
leurs meilleures recommandations
to
à nous
provide the
autres ici
best
dans le domaine
possible
de santé
evidence to
publique.
us in
Et
the area of
on va
public health,
discuter
and we
aussi,
will be having
on
discussions.
continue de
We
discuter
continue
les
to
données
have
probantes
discussions
au sein
on
de
data
notre comité consultatif
and on the evidence
spécial.
within our
Merci. Je
advisory
pense que Dr.
committee.
Sharma veut
I think
répondre
Dr.
aussi
Sharma had
un peu.
something that
Merci.
she wanted to say as well.
No, I'm sure other people have the same question, so I thought I would respond in English as well. So the question is really related to the press conference, the press releases that AstraZeneca has put out regarding their interim analysis and then the response from the National Institutes of Health in the United States. So I think first and foremost, it's important to know that these are press releases. These are ways to communicate interim analysis. And AstraZeneca has said that their press release was regarding data that had an earlier data lock time, which was February 17th, and that's not uncommon. So every other vaccine manufacturer has done the same thing. They put out interim data in the form of a press conference or press release. This has been a little bit unusual in that usually that press release is followed by a number of months before they submit their final data. In this case, AstraZeneca will likely be doing their next analysis, which is a more complete analysis over the next few days. So I think the bottom line is there's some information that's there. It's not the complete data package. Health Canada will look at the complete data package when we get that, and we're expecting to see that in sometime in April, and we'll assess all of that and communicate any of those results. Based on the findings that we've seen, and even if there are some differences in terms of the final data points, really the bottom line is that it doesn't change the recommendations with respect to the AstraZeneca vaccine in Canada at this point in time. So we've done the review, we've provided all the information on the basis of the review, and that hasn't changed. So clinically, in terms of the administration, that does not change. But of course, this is information that we will continue to monitor. At this point in time, we, of course, believe that the benefits of the AstraZeneca vaccine continue to outweigh the risks. And then the other part of the question was really around concerns about how this is interpreted and potential implications on vaccine confidence. And of course, that's something that's of concern to us, right? So we've said this many times before that even the most effective vaccine it only works if people trust it and agree to receive it. And once, it's like any other reputation, once potentially there's some doubt that creeps into that reputation, it's that much more difficult to gain that back. So I think, the press and the concerns around the AstraZeneca vaccine do not help. But what is really important is that we continue to put out accurate and reliable information. So if there is any change to the safety profile, if there is any significant change to how effective this vaccine is, we will take a look at that information and we will communicate it. Thank you.
Je peux avoir ma follow-up?
Can I have my follow-up?
Oui, vas-y avec ton suivi.
Yes, go ahead.
Okay, j'attendais que tu m'invites à le faire.
I was just waiting for you to tell me if I could go ahead with my follow-up. So
Peut-être
follow-up.
pour vous, Dr. Berthiaume, si je
Dr.
comprends bien,
Berthiaume,
juste
if
pour
I
être
understand
certaine,
correctly, just to
vous
be
allez
sure here,
réviser les
you
données
will be
d'AstraZeneca,
reviewing
mais
the AstraZeneca
il est
data,
peu probable
but it
que
is
l'approbation
unlikely that the
d'AstraZeneca
approval
soit révoquée par Santé
will be
Canada parce
revoked by
qu'on
Health
parle d'une
Canada
question
because
d'efficacité et
it
non
has to do with an
d'innocuité, comme vous
efficacy
dites,
and not
si
a
je comprends
safety
bien.
issue, if
Et
I'm
ma
understanding
question
correctly. And
suivie pour
my follow-up
l'un des 4
For
docteurs.
one of the 4
Certaines
doctors
provinces
here,
avaient
some
commencé à
provinces
déconfiner leur
had started to
population, leur
end
économie, mais
lockdown
Dr.
or
Tam, vous
release
disiez
it,
qu'il y a eu une
but
augmentation de
Dr. Tam,
15% des cas de COVID au
you're
pays
saying that
seulement dans la
there's
dernière
been an
semaine,
increase,
donc la
15%
tendance
of
est
cases of
peut-être
COVID
un
in the
peu
last
préoccupante.
week,
Est-ce que
so that's a
donc les provinces ont
worrying
peut-être
trend, isn't
commencé à
it?
déconfiner
So
trop
perhaps the
vite, à votre
provinces
avis?
have loosened restrictions a little too quickly?
Bonjour, c'est le Dr. Bertium. Je vais prendre la
This is
première
Dr. Bertium.
question.
I'll take your
Donc,
first question.
sur la base de cette
On the
revue-là,
basis
est-ce
of
que
this
Santé Canada pourrait
review,
retirer
is
l'approbation
it
du vaccin
possible that Health
d'AstraZeneca?
Canada
On n'a pas
may
vu les données,
not
comme a
approve
mentionné le Dr.
AstraZeneca?
Sharma,
Well, we
sur la
haven't seen
base
that
des
data, as Dr.
informations
Sharma has said. On the
préliminaires
basis of preliminary
qui ont
information
été divulguées dans les
that
médias.
was
C'est plus une
disclosed
question
in the media,
d'interprétation de
it's more an
l'efficacité.
issue of
Pour que les
interpreting
données
the
de ces
efficacy.
études-là
Now, for the data
changent
from
le
these
rapport
studies to change the
bénéfice-risque du
risk-benefit
vaccin, il faudrait que ce soit vraiment des
analysis for the
données
vaccine,
très
it would mean that
négatives. C'est pas ce qui
the
semble
data would
être
have
le
to
cas
be
à ce
very
moment-là.
negative,
Donc,
which
je vous
does
dirais,
not
selon
seem to be the case
l'information
at this
disponible,
point. Based on the available information,
il semble peu probable
it
qu'il y ait un
seems
changement au niveau de
unlikely that there
l'approbation du
would be a
vaccin
change as to the
d'AstraZeneca. Ceci dit,
AstraZeneca vaccine being
l'information
approved.
additionnelle
However,
d'autres
additional
essais cliniques peut
information
nous
from
donner plus
other clinical
d'informations
testing
sur
could
son
provide more
efficacité dans les
information as to
sous-groupes,
its efficacy
sur le
in
profil d'effet désirable. C'est tout
subgroups
ça qu'on va
and the
revoir lorsque
profile
l'information
for
va
adverse
être
events.
soumise à Santé
All
Canada.
of this
C'est
will
sûr qu'on va
be
avoir
submitted
des
to Health
discussions dans
Canada.
l'intérim
In
avec
the
le
interim, we
manufacturier
will be having
AstraZeneca
discussions with
et aussi avec
AstraZeneca
nos collègues
and with
américains
our
pour voir
counterparts
ce
in the
qu'il y en est
US
là, au
to
niveau des
see
données. Mais à ce
where
moment-ci,
things
je pense que ça serait
stand on the data.
induire un petit
But I
peu
think
ou
it would be in a
être faussement
way
alarmiste de suggérer que les
alarmist
résultats des
to
essais
suggest that
additionnels
the results of
cliniques qui ont été
additional
conduits aux
clinical
États-Unis pourraient
testing in the
conduire à un
US could
changement au niveau
lead
du
to
statut
a change in the
d'approbation du
approval
vaccin
status for this
d'AstraZeneca au Canada.
AstraZeneca
Merci.
vaccine here in Canada. Thank you.
Et bonjour, c'est Dr. New.
Hello,
Peut-être
this
je
is
peux
Dr.
répondre,
New. Now
commencer
I
à
could
répondre à
start
votre deuxième
answering your
question.
second question.
Concernant l'augmentation
As
des
to
cas un peu
the
au fur et à
increase in
mesure à travers les
cases
pays, mais
over the
aussi les mesures de santé
course of
publique.
this week and throughout
C'est
the
sûr
country
que dans
and
chaque province et
public health
territoire, c'est
issues,
très important
clearly in each province
d'avoir
and
un bon
territory,
système de
it's important to have
surveillance et
a
de
strong
suivre étroitement
monitoring
qu'est-ce qui se
system in
passe,
place to
même à
really
l'échelle
closely
locale.
follow what's
Ce
happening
qu'on
even
voit
at the
ici,
local level.
comme dit à
What
l'échelle
we're seeing
fédérale
here at a
nationale, c'est
federal,
oui,
national
il y a
level
une
is that yes, there's
augmentation
been an
et
increase.
vraiment, si les provinces et
If
territoires
the
commencent
provinces
peut-être
and
à assouplir
territories start loosening their
leurs mesures
restrictions,
de santé publique, il faut faire ça avec beaucoup de
it has to be
prudence.
done very
Et si
carefully.
on voit une tendance,
And if we
le
note
taux d'infection
that
commence à
there is a
augmenter aussi avec
trend,
les autres
an increasing
indicateurs
trend,
de gravité tardif,
or
aussi
that
si
these
ça commence à augmenter, c'est
serious
sûr que les
repercussions
autorités
are
des
starting to increase
provinces
as
et
well. Clearly,
territoires
the provincial and territorial
doivent
authorities
réviser
will have
et
to
peut-être modifier leurs
revise,
mesures de
perhaps
santé
change
publique.
their public health
C'est quelque
measures.
chose, c'est un enjeu actuel.
This is
On
a
discute
very
vraiment au
real
sein de
issue.
notre
We just have these
comité
discussions
consultatif
within
spécial
our
et
special advisory
c'est
committee
vraiment quelque chose
about these matters,
à suivre
and this is
étroitement.
something that we
Merci.
follow closely. Thank you.
Parfait. Donc, prochaine question. Next
Very well.
question.
Merci. Thank you. Our next question. La prochaine question, Mia Rabson, the Canadian Press. À vous la parole. Please go ahead.
Yeah, I think this question is probably for Dr. Tam. You've talked about sort of the increase or that the severe illness, the ICU numbers, hospitalizations are starting to creep back up again. But there was some data out of Alberta today suggesting, I believe Dr. Hinshaw said, almost 90% of the cases there in the ICU are people under the age of 65. Are we seeing nationally that there is a higher incidence of severe illness in younger people now, or is it more that there are there's less illness amongst seniors, partly because of the vaccine?
Yes, I think it's a sort of complex picture, but what I will say is that with increased replacement, if you like, of previous virus strains with the new variants, particularly the B117 variant, we know that it can take off fast. So its reproduction number, which is something that we talk about fairly frequently, is higher. So it has faster spread. And right now, the highest rates or highest incidence is in the younger age groups. As soon as you get more numbers of people, you're going to see more cases, I think, of severe outcomes. there's been a much stronger evidence coming out of the United Kingdom and elsewhere to say that this B117 variant does result in more severe illness. And so, and it does it across the age groups. So more severe illness if you get it in the elderly, but also in the younger age group. So if these numbers increase in the younger population, I think we're going to see increases in hospitalizations and ICU visits in these age groups. Whether the vaccine has had an effect, that's an important question. I don't think we can sort of say for certain, but what we've seen is a drop in incidence in the 80-year-olds and older. That's some of the first groups to be vaccinated, particularly in long-term care facilities. So that is a positive sign. But we've just began the vaccine programs. Many community-based older adults, the ones that are not in congregate living, haven't been vaccinated yet. So we need to be really careful. And that it's possible to see an increase in severity in any age group with the new variants.
Thank you. And I think my next question is for Dr. Sharma or Dr. Berthiaume. With regards to AstraZeneca last week, the European Medicines Agency decided to put a warning on the authorization regarding the blood clots, noting that there was no increased risk of getting a blood clot, but that they couldn't rule out or in whether or not it played a role in that one specific kind of blood clot. I'm just wondering if Health Canada is considering adding such a warning to the authorization.
Yeah, so the short answer to that is yes. So we are looking at that. We were observers at that European Medicines Agency subcommittee meeting. We've looked at the data as well, and so we're in the process of making similar changes to the information for Canadians. And of course, as we always would, we will communicate that once that's complete.
Thank you. Merci.
Prochaine question.
Next question. La prochaine question. Catherine Lévesque, La Presse canadienne. Your line is open. À vous la parole.
Oui, bonjour à vous tous.
J'aimerais revenir sur quelque chose que vous avez
I'd like to get
dit,
back to
Dr.
something
New, juste avoir
you
une
referred to,
précision.
Dr.
Vous
New.
dites
I'd like a
du
bit more
côté de
information
la
about this.
réouverture des
You
provinces,
said as
ça
to
commence à
provincial
augmenter trop vite
reopening, if the
la
numbers
transmission
increase
du virus
and
et
if
qu'il
the
faudrait
spread
peut-être
increases,
modifier les mesures de santé
you might
publique
have
dans les
to,
provinces.
there might have to
Je
be
me demandais
change to
si
public
vous
health measures in the
considérez qu'à ce
provinces. Do
moment-ci,
you think that at
il
this
faudrait
point,
effectivement que les provinces
the
revoient leur plan
provinces
de
should
réouverture? Est-ce que vous pensez
revisit
qu'à
these
15%
reopening plans? Do you
d'augmentation
think that with an
et avec
increase
la
in
transmission du virus
15% and given
B117, on est
this
déjà dans cette
B117 variant,
situation-là ou
do you think that we're
encore?
already in that situation?
OK, merci pour la question.
Okay,
Je
thank you for
peux
your
peut-être
question.
préciser.
I could maybe say
Peut-être,
this.
même elle a entendu, je n'ai pas dit que les provinces
I didn't say
commencent
that
à
the provinces
assouplir les
are
mesures de
starting
santé
to
publique
loosen
trop
up restrictions
rapidement,
too
mais
quickly, but what I
c'est
am
quelque
saying
chose
is
à
that
suivre
it is something
étroitement
that
parce
needs
que,
to be
oui, on voit
closely
maintenant, à
followed
l'heure actuelle, une
closely
augmentation
monitored, because at this
des cas
point
aussi,
we're seeing an increase
hospitalisation
in
et tout ça.
hospitalization rates as well.
C'est vraiment, je pense que c'est quelque chose pour les provinces et territoires,
This is
mais aussi
something
à l'échelle locale.
that's
Il faut
relevant for
vraiment
provinces and
suivre
territories, but
l'épidémiologie.
also we
Il
have to have
faut vraiment
keep
avoir
a
tous
close
les
eye on
moyens
epidemiology at the local level.
disponibles pour
You need to have
faire un bon
all
suivi des
possible
contacts,
means to
aussi
follow, to
isoler
do the
les
contact
cas
tracing, to
identifiés, tout ça,
isolate, identify,
pour assurer que
to make sure
c'est tout comment dire, sous contrôle.
that
Donc,
everything is under
si on
control.
continue peut-être à voir que
If we continue to
les
see
indicateurs commence
indicators
pas dans une bonne direction avec une
going in
tendance
the
qui
wrong
continue à
direction, if you
augmenter.
will, with an
Oui, c'est
increasing
sûr que
trend.
les provinces et
Clearly, the
territoires, mais
provinces and
peut-être que plus à
territories,
l'échelle
and
locale,
perhaps actually even more
il faut
so at the
modifier
local
les
level,
mesures de santé
there may
publique.
need to
Mais
be a change in
c'est quelque
public health
chose, oui,
measures.
on est dans les
Yes, it
premières
is
étapes, je pense, dans
something
plusieurs
that we
provinces
can
et
say is
territoires
that we're at the first
d'assouplir les mesures
stages
de santé
in
publique. Mais
some
je peux
loosening of
parler, je
restrictions
pense,
for public health
peut-être
measures
pour au moins
in some
les
provinces and
autorités de
territories.
santé
What I
publique.
can say for public health
Tout le monde
authority is
est
that
conscient,
everyone is
on veut
conscious
vraiment
of
qu'on
this
continue avec une
issue
cadence très
that
prudente
we
et
want to have a very cautious
on va voir
cadence
qu'est-ce qui se passe
and
et
see
si c'est
how
nécessaire de
things evolve
modifier, je
and
pense que
whether
les
we need to
autorités sont prêtes à le faire.
make some
Merci.
changes, then I think the authorities are prepared to do that.
Merci de la précision. J'ai
Thank
aussi
you
une
for that.
question pour peut-être
I have
M.
a question
LeBlanc
for
et
Mr.
peut-être
LeBlanc
Mme Hajdu, si vous
and
voulez
Ms. Hajdu.
répondre également. Il y a les conservateurs, aujourd'hui, qui
The
réclament un
Conservatives
plan de
today have been
réouverture,
asking for a
un plan pour
reopening
la levée des
plan
restrictions restrictions, un peu comme ça s'est fait aux États-Unis
do away
ou au
with
Royaume-Uni.
the restrictions in the same
in
the way that the US and the UK have done within the 20 sitting days in Parliament. Is that something that's on your radar? Would you be prepared to present this type of a plan while we are here expecting perhaps a third wave?
Moi, je pourrais offrir quelques commentaires et Patty pourra
LeBlanc, I could
ajouter
add a few
au
comments and then
besoin.
Patty may have
Évidemment,
some
les
things to add as
conservateurs
well.
parlent depuis
The
longtemps
Conservatives have now
d'utiliser
for a
des
while
politiciens pour
been
s'ingérer dans
asking,
les questions
have
qui
been
devront
trying
proprement
to
être dans les mains
ask
des
politicians to
scientifiques et des
encroach in
médecins.
areas that should
Au
really be the
Canada,
responsibility of
constitutionnellement,
doctors
les
and
provinces
specialists
ont
in this field.
l'autorité
The
d'appliquer
provinces in Canada
des
have the
mesures
constitutional
sanitaires
responsibility
nécessaires et on a
for
vu
applying
depuis le début de la
health measures.
pandémie des
And we've
différences
seen
dans certaines
from
provinces,
the
c'est parce
beginning
que
of the
c'est
pandemic
proprement
that
leur
provinces
juridiction.
have
C'est
adopted different
pourquoi à ces
measures because
conférences
it's
de
a really
presse,
an
vous
area
verrez
of
souvent
provincial
le
jurisdiction. And
Dr
this is why
New,
you will
le
often see
Dr
Dr.
Tam
New, Dr.
parler
Tam
de suivre des
referring
conseils des
to
autorités de
following
santé
the
publique
advice from public
locales
health authorities
parce
in
que
the
à
local
travers le
regions,
pays, il peut y
because
avoir
throughout the
différentes
country there may be
circonstances
different
qui
circumstances that may
nécessitent
require
différentes mesures.
various
Évidemment, le
measures.
gouvernement fédéral a
Of
un
course,
rôle
the federal
essentiel
government has
d'appuyer
an
les
essential
provinces.
role to
Nous
play in
l'avons
support
fait
of the provinces, which
financièrement
we
d'une
have done
façon
financially
assez importante depuis le début de la
significantly from the
pandémie.
start of the
Nous allons
pandemic, and
continuer
we will
d'appuyer
continue
les
to
provinces et les
support the
territoires
provinces and
financièrement
territories
pour
financially
s'assurer
to make
qu'ils
sure
ont tout ce qu'ils ont
that they
besoin
have
pour
everything they
protéger leurs
need to
citoyens.
protect their citizens.
Nous avons aussi un rôle
We
essentiel
have
comme
an
gouvernement
essential role
fédéral
at the federal
à
level as a
appuyer
federal
les
government
Canadiens, à appuyer les entreprises
in supporting
canadiennes
Canadians,
pour que
supporting
les
Canadian
autorités
businesses,
provinciales et
so these provincial and
territoriales
territorial
puissent
authorities
prendre des décisions
can make
nécessaires
the
pour
necessary
protéger le
decisions to
public
protect the
en
public,
sachant en même temps que
knowing at the
les
same
appuis
time
économiques, les appuis
that
financiers
financial
sont en
support
place. Alors ça, c'est un
is
rôle
in
que nous
place, and
avons
that is the
joué
role that we have
depuis le
played
début de la
from
pandémie. Nous
the
allons
start of this
continuer de
pandemic. We
travailler
will
évidemment avec les
continue, of course, to
provinces,
work with the
mais que les
provinces,
conservateurs
but for
veulent que
the
les
conservatives
politiciens à la
to
Chambre des
say that they
communes
want
et
politicians
non
in the
pas des
House
médecins et
of
des
Commons
scientifiques s'imposent dans des
rather
juridictions
than
provinciales.
scientists
Nous trouvons ça un peu
to make these
bizarre comme
decisions. We
approche
think
et ce n'est
this is
pas
a weird, a
l'approche que nous
strange
avons
approach. This is
privilégiée
not the
depuis
approach
le
that we
début de la
have taken
pandémie,
from the
mais
start of the pandemic.
peut-être Patty Hajdu
Perhaps
pourra ajouter quelque
Minister
chose.
Hajdu has something to add.
Oui, merci Dominic. Je pense les conservateurs,
Thank you,
ils ne savent pas
Conservatives
la santé et la sécurité
did
pour
not realize
Canadiens, la
that
sécurité économique est intégrée.
health
En
and
anglais,
economic security
I
is
think
integrated.
the motion today, as my colleague has mentioned, first of all, underscores a lack of confidence in the public health authorities and the scientists that are leading our response across the country, and a lack of understanding about the jurisdictional right and responsibility of provinces and territories to deliver health care and to protect the health of their constituents, namely in their provinces and territories. But I think it also reflects a lack of understanding that you can't have a strong economy if your citizens are worried about getting sick every single time they go out. So it's very important that we continue to have a response here in Canada that is guided by science, that is guided by public health officials, that works to support the security, the economic security of Canadians, as we have over the past many months, but also has a true foundation of science-based measures at its core. Indeed, I think my colleague is right when he says it shouldn't be politicians that determine when, in fact, a community should relax public health measures, but it should be public health and science leaders. Thank you.
Merci. Thank you. Next question. Prochaine question.
Thank you. La prochaine question, our next question. Tana McCharles, Toronto Star. À vous la parole. Your line is open.
Hi, thanks. Dr. Sharma, given what you said about Canada weighing the evidence right now on the blood clot issue for AstraZeneca, can you tell me what your advice is to the health workforce that are looking at vaccines right now? Are you suggesting that maybe they should hold off in administering that vaccine in particular to anyone with heart issues or vascular problems?
So at this point in time, we're not changing any of our recommendations, so that the vaccine would still be indicated for those who did not have any other contraindications, so we're not allergic to any of the components of the vaccine or the vaccine itself. We do make mention of people that potentially have an increased risk of bleeding, but that's with any vaccine because it's an injection. So at this point in time, we would say that for people that are 18 years of age and over, that you would look at, of course, the risks and the benefits, but that AstraZeneca would be the vaccine would be an appropriate choice. Now, as we've said, we are looking at potentially making changes to the monograph, the information that goes with the vaccine, to say that there have been reports of this type of rare clot. So if people have any of the symptoms of clot, so in the case of the central ones, the ones that are involved the veins around the brain, if they have a sudden headache, if they have a headache that persists past 3 days, make sure that they go in and be seen. If they have any other symptoms of clot, so shortness of breath, pain or tenderness in their calves or legs or anything like that, then they should go and be seen. Overall, we are not making any changes to the recommendations at this point in time. The issue of looking at the specific type of clot is ongoing, as it is with clots in general. And just to say that the information that we've seen in terms of the more common types of clots in general has not shown any increased risk with people getting the AstraZeneca vaccine compared to people that are not getting the vaccine.
Thanks. And I don't know who can give us this, but perhaps you might be able to say. I'm looking for an update, I guess, overall on the other 3 vaccines that we have less clarity on in terms of delivery schedules and also the approval of Novavax. So where are you at on the approval of Novavax? And do you have any updates on when the supply of AstraZeneca that was contracted for delivery from the U.S. beyond the 1.5 that Biden's giving us, when that's coming and when the Johnson & Johnson vaccine is coming?
Sure. So maybe I can answer the Novavax review question first and then turn it over to others on the supply questions. So Novavax is under review, as we've said before. We are still expecting significant chunks of information from the company, both on the manufacturing side, but also on the clinical side. So the large phase 3 trial involving the Novavax vaccine is not expected to report out until next month at the earliest. And so we really would depend on getting both those packages of information before we were able to say how close we might be to making a final decision.
Merci, thank you. Next question, prochaine question.
Thank you, merci. La prochaine question, next question, Lynn Desjardins, Radio-Canada International. Your line is open. À vous la parole.
Yes, can you please tell me whether the AstraZeneca vaccine is effective in the 3 variants? There was some question at one point whether it was effective in use against the South African variant.
Right, so I can start with that question. So with respect to when we look at variants and how effective vaccines are against them, obviously the best information that we can get is if they're being used and we're getting real world information from how people are responding. For the AstraZeneca vaccine, we have seen both in laboratory tests and from real world evidence that it seems to be quite effective against the United Kingdom variant, the 117 variant. And as you mentioned, the South African variant, there was some lab data where you take blood from people who have been vaccinated with a vaccine and then test it against, see if it performs antibodies against that variant, where the AstraZeneca vaccine did not perform very well. However, that's not the only response from the vaccine. So in general, right now, the question is whether or not the AstraZeneca vaccine has good efficacy against the overall South African variant. But what we do know is that it is likely still quite good, even in the South African variant, for severe disease, so hospitalizations and potentially deaths from COVID-19. So I think we still need a little bit more information from the South African variants with respect to AstraZeneca, but again, in the places that it matters the most, again, severe disease, hospitalizations, and deaths, it seems to be quite effective against the variants.
Likely still quite good.
Thank you.
In the South African variant for severe disease, so hospitalization and potentially death from COVID-19.
Prochaine question et s'il y en a qui peuvent fermer leur micro en arrière, on entend la conférence de presse à la télévision.
Unfortunately, we're hearing your sound. Somebody has their mic on.
Tom Perry, CBC News. Votre ligne est ouverte. Please go ahead.
Hello, thank you for taking my questions. Preliminary research from the United Kingdom has found that delaying the second shot of some vaccines for cancer patients leaves them partially unprotected. I'm just wondering if there's anything being done to update the guidance surrounding delaying second shots for up to 4 months for people in this situation.
This is Shrita. Maybe I'll take that question. As I understand it, the National Advisory Committee on Immunization will, of course, take on board any ongoing data that's available. So I would expect that this kind of data will be looked at. Again, some of the data that's been released in the media, you do need to dig into a bit in a bit more detail. But that's the type of information I expect will be examined.
Else want to comment on that?
Your follow-up?
Oh, sure. I'm just wondering if federal officials are going to be giving Canadians any more direction or advice on what they can do once they're vaccinated. I mean, can they go see their family? Can they attend gatherings? The Centers for Disease Control in the United States has put out some guidelines. I'm just wondering if we're going to see something like that in Canada.
So this is an area of active discussion with the provinces and territories. Obviously, we're in our early days in terms of vaccine coverage. And but some of the very initial areas where provinces are re-examining their public health approach will be for long-term care homes, and then looking at healthcare workers who've also been vaccinated in terms of whether they need to observe the same quarantine, for example, if they've been exposed. So that's a key update. But I think for now, the key message is that everyone needs to keep up with their personal protective measures, which is wearing a mask, hand washing, watching your distance, and avoid close, crowded conditions. I think as more and more people get vaccinated, I would expect the advice to evolve as we go along, but it's a little bit too early. And then there's the variants, of course, that's escalating as well as we speak with increased activity in communities. And I think community transmission and that sort of activity overall really is what drives the local decisions on what kind of restrictive public health measures need to be implemented.
Merci, thank you. We will take a final question. Nous allons prendre une dernière question. Opérateur.
Thank you, merci. The last question is from Catherine Aylesworth, Global National. Your line is open. À vous la parole.
Hi, thank you. My question is for Dr. Tam. There's a new report out today showing a troubling rise in incidents of anti-Asian racism in Canada. The pandemic has only made this worse. You've been at the crossroads of both. Can you speak to the toll that this is taking?
Yes, so I think the pandemic has had a significant toll on everyone. There is no doubt. But some populations have experienced more impact than others. And certainly in the last report that I published, as the Chief Public Health Officer's annual report, I pointed to the inequities and for which racism, but also other social and economic factors result in certain populations being disproportionately impacted by COVID-19. And I think that one can understand the frustration and, that being a general sentiment, but there's never a excuse for racism in our society. So I think that is really important, and people need to support each other and be patient. And I have to say that in general, Canadians have been very supportive of each other, which is how we got through the pandemic to this point. And we just need that to continue for a bit longer as the vaccine is rolling out. So absolutely, we should not tolerate hate or racism against any groups in our community, but we just got to be compassionate and patient with each other.
Okay, thank you so much. No follow-up.
Merci. Ceci met donc fin à la conférence de presse d'aujourd'hui. This puts an end to today's press conference. Thank you, everyone.